Hello everyone, my name is Courtney Wilson and I'm an OBGYN specialist here at the Caring for Women's office located in Denton, Texas. This small facility lets us take in every consideration for each female patient and really get to connect with them on a personal level. Polycystic ovary syndrome is going to be our main focus as we provide important information over this disease, the treatments, the causes, the symptoms that go about it, and how it affects women, and if it's usually short-term or long-term effects of it. Ovarian cysts affect about 3 million women each year, so ovarian cysts are a pretty common thing for female to get. These cysts are fluid-filled sacs located on the female reproductive organs, which are also known as their ovaries. Ovarian cysts are typically asymptomatic and benign, which is usually understood as not being harmful or cancerous. Polycystic ovary syndrome, however, is a hormonal disorder that causes small cysts to be formed on the enlarged ovaries. The symptoms that arise with this usually consist of abnormal menstruation, weight gain, acne, facial hair, and unwanted male features such as the hair growth, and can also have symptoms of depression too. To treat this kind of disorder, patients need to be prescribed medications to help with the hormonal factors, to help regularize their periods, increase the chance of fertility, hair growth inhibitors, and medications to prevent diabetes and lower the levels of cholesterol. I will be talking about a specific case that I have encountered at the Denton Caring for Women. I have a 22-year-old Caucasian middle-class female who has recently been diagnosed with polycystic ovarian syndrome. In recent years, she has noticed excessive hair growth and has reported having abnormal periods, irregular bleeding, mild cramping, and slight depression throughout her life prior to this diagnosis. I decided that it was in the best of interest to do a physical and pelvic examination on her. And with that, I ordered some blood tests to see just her hormones levels and see what the blood test brought back. After the physical examination and the pelvic examination, I saw symptoms of enlarged ovaries, enlarged clitoris, and both hair growth and acne. And then the blood test showed abnormal hormone levels. To help this patient, I prescribed a birth control pill to see how it affects her period and the hormone levels, a hair growth inhibitor, and other hormones to help treat the imbalance of the hormones in her body. To all the healthcare providers out there or the individuals in this field, this disorder is not completely curable, but with the proper medications, the cysts will stop being so inflamed, and the hormonal imbalance can be equalized. This disorder is not preventable, but early identification can help prevent long-term complications. This disorder is not as common as others, but it is important that the general population and healthcare providers do know about it and are aware of the symptoms and treatments that should be associated with this disorder. There's a lot of unanswered questions that come along with polycystic ovarian syndrome, such as how it's caused, if it's genetic, if it's what causes this, and why these individuals have a hormone imbalance. And I think that together, all the healthcare providers, we need to find out how patients develop this disorder and how a certain hormone imbalance can affect other hormones in the body, and ways to treat this, completely treat this disorder, and allow females to live a happy and healthy life.